What if I told you that your heart right now is the most powerful tool you have for living longer, stronger, and healthier? What if I told you that decades of heart problems could be prevented with choices you make today? Simple things like walking a little more, eating a little better, and checking your blood pressure? What if I told you that ignoring it could cost you your energy, your independence, even your life? Stay with me, because by the end of this video, you'll discover how a few small changes could protect your heart and transform the way you age, one beat at a time. Cardiovascular diseases are recognized as the leading global cause of death, and understanding why requires looking at how these conditions develop, spread, and remain largely unnoticed until they become severe. Across the world, millions of people experience some form of heart or blood vessel disease, including heart attacks, strokes, hypertension, and congestive heart failure. What makes cardiovascular diseases so dominant is not just their severity, but also their universality. They affect people of all ages, genders, and backgrounds. Urbanization, unhealthy food choices, reduced physical activity, and increasing stress have all contributed to a widespread rise in these conditions. In many regions, dietary habits have shifted toward high sugar, high fat, and highly processed foods, leading to obesity, diabetes, and high cholesterol, all major risk factors. Another reason cardiovascular diseases remain the top cause of death is their silent progression. Many individuals do not experience noticeable symptoms until the disease has already caused significant damage. High blood pressure, for example, can quietly strain the heart and damage blood vessels for years without producing any warning signs. Similarly, plaque buildup in the arteries can take decades to develop, and when symptoms finally appear, they often indicate an advanced stage that is harder to treat. This lack of early detection makes the condition far more dangerous, especially in communities where routine medical screenings are rare. The aging global population also contributes to the rising numbers. As life expectancy increases, more people live long enough to develop age-related cardiovascular problems. With age, arteries naturally lose elasticity, the heart becomes less efficient, and chronic conditions like diabetes become more common, all of which raise cardiovascular risk. In many countries, healthcare systems struggle to provide adequate prevention programs or access to early checkups, allowing these diseases to spread without intervention. Environmental and socioeconomic factors play an additional role. Air pollution, sedentary jobs, smoking, and limited access to healthy foods all create environments where heart-related illnesses become more likely. Stress from financial pressure, work demands, or social instability can push blood pressure higher and encourage unhealthy coping habits such as smoking or overeating. Even in wealthier nations with strong healthcare systems, lifestyle choices heavily influence outcomes, making cardiovascular diseases a widespread challenge regardless of economic status. Ultimately, cardiovascular diseases lead global mortality not because they are unstoppable, but because the factors that contribute to them are deeply embedded in modern life. Many of these factors can be controlled, but awareness, early detection, and consistent lifestyle changes remain essential in reducing their impact worldwide. Lifestyle factors play a central role in the development and progression of cardiovascular diseases, and understanding their impact is crucial for both prevention and management. Diet, physical activity, smoking, and stress levels are among the most influential factors, and each one affects the heart and blood vessels in distinct ways. A diet high in saturated fats, trans fats, refined sugars, and excessive salt contributes directly to the buildup of plaque in the arteries, a condition known as atherosclerosis. Over time, this narrowing of the arteries forces the heart to work harder to pump blood, increasing the risk of hypertension, heart attacks, and strokes. Conversely, diets rich in fruits, vegetables, whole grains, lean proteins, and healthy fats help maintain healthy blood pressure, cholesterol levels, and body weight, all of which reduces strain on the cardiovascular system. Physical activity is equally critical. Sedentary lifestyles, which have become increasingly common due to office-based work, long commutes, and screen-centered leisure, reduce the efficiency of the heart and lower overall circulation. Regular exercise strengthens the heart muscle, improves oxygen delivery to tissues, and supports healthy weight management, which in turn reduces the burden on arteries and prevents insulin resistance. Even moderate activity such as brisk walking or cycling for 30 minutes a day has been shown to significantly lower the risk of heart disease and stroke, highlighting the power of consistent movement. Smoking remains one of the most harmful lifestyle factors affecting cardiovascular health. Tobacco contains chemicals that damage the lining of blood vessels, increase blood pressure, and promote the formation of clots, all of which dramatically increase the risk of heart attacks and strokes. Secondhand smoke exposure also contributes to cardiovascular risk, making smoking a public health concern beyond the individual smoker. Quitting smoking reduces these risks over time, emphasizing the reversibility of lifestyle-related damage when healthy changes are adopted. Chronic stress and poor mental health further exacerbate cardiovascular risk. Prolonged stress triggers the release of hormones like cortisol and adrenaline, which elevate blood pressure, encourage unhealthy eating habits, and increase inflammation in the arteries. Sleep deprivation, anxiety, and depression are also linked to higher rates of heart disease, suggesting that emotional and psychological well-being is closely tied to physical heart health. Collectively, these lifestyle factors interact and compound over time, creating a cumulative risk that can be prevented or mitigated through conscious choices, structured routines, and supportive interventions from healthcare providers and community resources. Many cardiovascular diseases progress silently, which is one of the reasons they are so dangerous and widespread. Unlike conditions that produce obvious early symptoms, heart disease often develops gradually over years without noticeable signs, making early detection difficult. For instance, high blood pressure, a major contributor to heart attacks and strokes, frequently shows no outward symptoms, earning it the nickname the silent killer. Individuals may feel completely normal while their arteries are slowly narrowing, their heart is under strain, and their risk of serious cardiovascular events steadily increases. This lack of early warning allows the disease to reach advanced stages before any intervention is sought, increasing the likelihood of complications and reducing the effectiveness of treatments. The silent progression of cardiovascular disease is closely linked to atherosclerosis, which is the buildup of plaque within the arteries. Plaque develops slowly as fat, cholesterol, and other substances accumulate on arterial walls. Over time, this narrows the blood vessels and restricts blood flow to vital organs. Many people remain unaware of this process because their bodies adapt to the gradual changes, and only when blood flow becomes critically reduced do symptoms such as chest pain, shortness of breath, or fatigue appear. By that stage, the risk of sudden events like heart attacks or strokes is significantly higher, and interventions often become more complex and urgent. In addition to atherosclerosis and hypertension, other cardiovascular conditions also progress silently. Heart valve disorders, certain types of arrhythmias, and early stages of heart failure may remain unnoticed for months or even years. Some symptoms, when they do appear, can be subtle or mistaken for general fatigue, stress, or aging, which further delays diagnosis. The subtle nature of these warning signs highlights the importance of regular medical checkups, especially for individuals with risk factors such as obesity, diabetes, smoking, or a family history of heart disease. Early detection through routine screenings is therefore critical in combating the silent nature of cardiovascular disease. Blood pressure measurements, cholesterol testing, blood sugar monitoring, and imaging studies can identify problems before they escalate. Lifestyle modifications, medications, or medical interventions initiated at these early stages can prevent severe complications, improve quality of life, and significantly extend life expectancy. Understanding that cardiovascular disease often advances quietly underscores the need for vigilance, proactive healthcare, and personal awareness of risk factors and health indicators. Cardiovascular diseases are largely preventable, and research shows that most heart-related complications can be avoided through simple lifestyle changes and proactive healthcare measures. The preventability of these conditions lies in the fact that many of their underlying risk factors are controllable, including poor diet, lack of physical activity, smoking, excessive alcohol consumption, and unmanaged stress. By addressing these factors early, it is possible to significantly reduce the likelihood of developing serious conditions such as heart attacks, strokes, hypertension, and heart failure. For example, maintaining a balanced diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats helps regulate cholesterol levels, reduces inflammation in the arteries, and supports healthy body weight, all of which are crucial for preventing cardiovascular disease. Physical activity is another cornerstone of prevention. Regular exercise strengthens the heart muscle, improves circulation, reduces blood pressure, and helps control blood sugar and cholesterol levels. Even moderate activity, like brisk walking, cycling, or swimming for 30 minutes a day, has been shown to lower the risk of heart disease, highlighting that prevention does not necessarily require extreme or strenuous workouts. Consistency over time is more important than intensity, and adopting a physically active lifestyle early in life can yield long-term benefits for cardiovascular health. Smoking cessation is perhaps one of the most effective preventive measures. Tobacco use directly damages blood vessels, promotes plaque buildup, increases blood pressure, and raises the likelihood of clot formation, all of which accelerate the progression of heart disease. Quitting smoking, even later in life, significantly reduces cardiovascular risk, demonstrating that prevention is not limited to a single stage of life. Limiting alcohol intake also contributes to heart health, as excessive drinking can raise blood pressure and lead to cardiomyopathy, arrhythmias, and other complications. Preventive healthcare and early screening play an equally critical role in avoiding cardiovascular complications. Regular checkups, blood pressure monitoring, cholesterol testing, and blood sugar assessments allow individuals and healthcare providers to identify risk factors before they become severe. Interventions such as lifestyle modifications, medication, or targeted therapies can be implemented at early stages to prevent the onset of serious disease. Education and awareness are essential as well. Understanding risk factors, recognizing warning signs, and adopting heart-healthy habits empower individuals to take proactive steps toward prevention. Preventability underscores that cardiovascular disease is not inevitable, and with informed choices and consistent effort, the majority of heart-related illnesses can be avoided, allowing for longer, healthier lives. Early screening plays a vital role in identifying cardiovascular disease risks before they escalate into serious health problems. Many heart conditions, including high blood pressure, high cholesterol, and diabetes, develop gradually over time and often remain unnoticed until they cause significant damage. Routine screenings allow for the detection of these risk factors in their initial stages, when lifestyle changes or medical interventions can be most effective. Blood pressure measurements, for example, can reveal hypertension long before it produces symptoms such as headaches, dizziness, or chest discomfort. Identifying elevated blood pressure early enables timely interventions, which may include dietary adjustments, increased physical activity, stress management, or medications to prevent long-term damage to the heart and arteries. Cholesterol testing is another crucial component of early cardiovascular risk detection. Elevated levels of LDL cholesterol, commonly known as bad cholesterol, contribute to the buildup of plaque in arteries, increasing the likelihood of heart attacks and strokes. By monitoring cholesterol levels through regular blood tests, individuals can take steps to manage their lipid profile through diet, exercise, and, when necessary, medications such as statins. Detecting abnormalities before they lead to arterial blockages provides a significant advantage in preventing severe cardiovascular events. Blood sugar assessments are also important because diabetes is a major risk factor for cardiovascular disease. High blood glucose levels can damage blood vessels, accelerate atherosclerosis, and increase the risk of heart attacks and strokes. Early detection through fasting blood glucose tests, or HbA1c, measurements allows for interventions such as lifestyle modifications, dietary changes, and medications to control glucose levels, reducing the long-term cardiovascular risks associated with diabetes. These screenings collectively create a comprehensive picture of cardiovascular health, helping individuals and healthcare providers identify potential problems before they manifest as critical conditions. In addition to laboratory tests, imaging studies such as echocardiograms, stress tests, and coronary calcium scoring can detect structural or functional abnormalities in the heart that may not yet cause symptoms. These assessments provide valuable information about heart function, arterial health, and overall cardiovascular risk. By combining routine screenings with lifestyle awareness, individuals are empowered to take proactive steps toward heart health. Early detection ensures that interventions are applied at the most effective stage, significantly reducing the risk of heart attacks, strokes, and other serious complications, and allowing for the maintenance of long-term cardiovascular wellness. Heart health plays a central role in healthy aging, influencing not only physical ability but also mental clarity, energy levels, and overall quality of life. As people age, the cardiovascular system naturally undergoes changes. Arteries lose some of their elasticity. The heart may become slightly less efficient at pumping blood, and the risk of conditions such as hypertension, atrial fibrillation, and atherosclerosis increases. Maintaining cardiovascular health can slow or reduce the impact of these age-related changes, allowing individuals to remain active, independent, and engaged in daily activities. A strong heart supports mobility, endurance, and balance, reducing the likelihood of falls and injuries that can complicate aging. It also ensures that oxygen and nutrients are effectively delivered to all parts of the body, supporting cellular repair, immune function, and energy metabolism. Mental health and cognitive function are closely linked to cardiovascular fitness. Reduced blood flow to the brain, often caused by untreated hypertension or arterial plaque buildup, can contribute to cognitive decline and increase the risk of conditions such as dementia and stroke. Maintaining healthy blood pressure, cholesterol levels, and circulation through diet, exercise, and regular medical monitoring helps protect the brain, improving memory, focus, and overall mental performance in older adults. Additionally, physical activity that benefits the heart, such as walking, swimming, or yoga, has been shown to stimulate neurogenesis and enhance mood, reducing the likelihood of depression and anxiety, which are common challenges in later life. Energy levels are also heavily influenced by cardiovascular function. When the heart and blood vessels are strong, muscles receive sufficient oxygen and nutrients, allowing older adults to perform daily tasks with greater ease and stamina. Fatigue, shortness of breath, and reduced endurance are often signs of declining cardiovascular health, and addressing these through lifestyle changes can restore vitality and improve independence. Nutrition plays a complementary role, with diets rich in antioxidants, fiber, lean proteins, and healthy fats helping to maintain arterial flexibility, reduce inflammation, and support heart function. Avoiding excessive salt, sugar, and processed foods further reduces the risk of age-related cardiovascular problems. Preventive measures, including routine health screenings, stress management, and avoidance of smoking and excessive alcohol, allow individuals to detect risks early and take corrective actions. Engaging in social activities and maintaining mental engagement also indirectly support heart health, as emotional well-being is linked to reduced stress hormones that can strain the cardiovascular system. By focusing on cardiovascular wellness, aging adults can preserve physical function, cognitive ability, and energy, fostering a higher quality of life and enabling them to enjoy independence and vitality throughout their later years. In conclusion, cardiovascular health is the foundation of a long, active, and fulfilling life. By understanding the risks, embracing healthy habits, and taking advantage of early screenings, we have the power to prevent most heart-related complications and protect our vitality as we age. Every choice we make, what we eat, how we move, how we manage stress, directly impacts the strength and longevity of our heart. Remember, it is never too late to start caring for your heart, and small, consistent steps can create life-changing results. Good luck on your journey toward a healthier heart and a stronger, more energetic life. Thank you for taking the time to listen, and may every heartbeat guide you toward wellness, resilience, and happiness.